It is a deeply troubling moment when the person in charge of the nation's public health begins to spread misinformation that undermines one of the most successful disease prevention tools in human history. Robert F. Kennedy Jr., now serving as Health and Human Services Secretary, continues to cast doubt on vaccine safety and efficacy, and the consequences of his rhetoric could be deadly. Despite his technical endorsement of the measles vaccine, Kennedy's simultaneous claims that its immunity wanes very quickly and that it hasn't been safety tested not only contradict overwhelming scientific consensus, they dangerously fuel anti-vaccine sentiment at a time when cases are rising and children are dying. His assertion that we will always have measles because the vaccine supposedly loses effectiveness quickly is not just incorrect, it is reckless. Measles was declared eliminated in the United States in 2000, an extraordinary public health milestone only made possible by widespread vaccination. 2 doses of the MMR vaccine offer what experts like Dr. Paul Offit call lifelong protection. There is no scenario where that level of effectiveness would allow for the elimination of a disease if immunity truly waned quickly, as Kennedy suggests. The science is clear and the data are abundant. The measles vaccine works, and it works for life. To claim otherwise as a federal health leader sends a chilling message to the public. Misinformation from someone in his position doesn't just add confusion, it gives a dangerous legitimacy to conspiracy theories and fearmongering. Kennedy's comments are not made in a vacuum. They are being echoed and weaponized by anti-vaccine movements that have long used similar language to justify resistance to childhood immunizations. And we are already seeing the effects, a resurgence of measles, with 668 cases this year and multiple pediatric deaths. Before this, the U.S. hadn't recorded a measles-related child death in over 2 decades. That heartbreaking statistic alone should serve as a wake-up call. Kennedy's approach is also intellectually dishonest. By citing high measles numbers in Europe as a justification for U.S. policy, he engages in misleading comparisons. European outbreaks have largely been driven by low vaccination rates in specific regions, not by waning immunity, as he implies. The truth is that when communities in the U.S. fall below the critical vaccination threshold, outbreaks happen. Measles is extraordinarily contagious. The virus doesn't need much to spread, just a small, under-vaccinated community. And when officials like Kennedy cast doubt on vaccines, they give that spread fertile ground. His comments on vaccine testing are equally dangerous. Suggesting that vaccines have not been properly tested or that trials are unreliable undermines trust in the entire system. In reality, vaccines go through some of the most rigorous testing protocols of any medical product. While the nature of clinical trials has evolved over time, especially for vaccines developed decades ago, the assertion that vaccines weren't tested or monitored is false. Ongoing surveillance systems, post-market studies, and decades of data have repeatedly affirmed their safety. When issues do arise, the vaccines are modified or removed from circulation. The idea that vaccines should be tested with water or saline placebos, Kennedy's preferred benchmark, is scientifically flawed and ethically problematic. Using inert placebos when there is already a safe and effective vaccine available would mean denying participants protection against serious disease. It would put people at risk unnecessarily, something that no responsible medical trial would allow. Comparing new vaccines to older, proven ones is a standard, ethical, and scientifically sound practice. Yet Kennedy leans into these fringe interpretations, constantly picking and picking at the system, as Dr. Offit put it. He cherry-picks data and amplifies doubt, knowing full well the impact of his words. That's not just irresponsible, it's dangerous leadership. The United States is already teetering on the edge of losing its measles elimination status, and his words are pushing us closer to that line. We're not just dealing with a measles outbreak. We are witnessing a crisis of public trust, one fueled by political figures who exploit uncertainty and skepticism for personal or ideological gain. The cost is being paid by families, by vulnerable children, and by communities already grappling with healthcare disparities. In a time when scientific literacy and public health cohesion are more vital than ever, it is not enough for public officials to vaguely support vaccination. They must do so unequivocally, based on facts, not insinuations. There is no place for half-truths, vague doubts, or misrepresented data in the hands of someone tasked with protecting American health. The legacy of vaccines is one of triumph: the elimination of smallpox, the control of polio, the near eradication of measles. But all of that progress is fragile. It can be undone, and it is being undone by words like Kennedy's. The warning is clear: if this rhetoric continues unchecked, the consequences will not be theoretical. They will be visible in rising death tolls, preventable illnesses, and shattered trust in public health.